Hey, welcome. Welcome to my first live. Got a few more minutes before I actually start. We're going to do anything regarding nursing today, anything regarding, let me know if you can hear me. If somebody can comment whether they can hear me or not. Make sure my mic is on. My mic is on. So I'm here to answer your nursing questions or whatever you may have, whatever may be on your mind regarding nursing or anything like that. Let's see if I can see anything. Hey, hey. Um, Ms. Joyner and Mr. Tighten Up. Hey, how you doing? You can hear me. Okay, good. So this is my very first live. I am here. I had to figure out some things. I told you I was going live when I hit 2,000, and I've been over 2,000 subscribers for a while now. But I had some issues with YouTube. But now I'm here, and so we're going to basically talk about some nursing things or whatever's on your mind. I have a lot of content on here. Um, so whatever interests you all, whatever questions you have. Good, Miss Joyner. I'm good today. I'm just excited that this is my first live, first of many. I'm hoping to do this weekly. So we'll see how this goes today. And then after that, we will make modifications or tweak or whatever I need to do to make this better. So I appreciate you joining me for live today. And whatever I can do to help you all or answer any questions that you may have regarding uh, nursing or whatever it happens to be that um, whatever interests you. So what I will say is if you all don't mind sharing this so that people can know that I'm starting this process of doing live, you can share, comment, like all those things so that we can do this more. I plan to do this, like I said, about once a week. Once I start teaching in the fall next month, actually in August. I don't know how we're going to do this. I'll figure it out based on my schedule. But if y'all can do that for me by sharing and liking and do those things and invite people to come here so we can do this weekly, um, and I will answer your questions or whatever we need to talk about. Maybe sometimes I'll have a topic on mind and sometimes I won't, but this is a plan to do. So, do you think the current healthcare crisis? That's a good question. So the question is, do you think with the current healthcare crisis and shortage, the LPNs will make their way back to the hospitals? I honestly don't know. And when you say shortage, when we say shortage, I think about the fact that they've been saying we've had a shortage since I was come out as a nurse. I came out as a nurse in 2004. So shortage meant where? Because I will tell you they will say there's a shortage and there's shortage in certain areas of nursing, but not necessarily the whole conglomerate of the nursing profession. There's a shortage. I do think the LPNs have their place. I do think some of these smaller hospitals that are not, the hospitals that are not magnet status, like where I live in Tennessee, we have a hospital called Vanderbilt, which is a well known hospital here. And they are magnet status, which means they are going to only hire certain people to get the money that they want to get. Smaller hospitals actually still do have LPNs in their hospitals. I actually do clinicals, which I'm going next week to a small community hospital that hires LPNs in the hospital setting. So you may have to find, or whoever's LPN may want to go find a hospital that's smaller that will allow you to work in the hospital, whereas some of the bigger hospitals will allow LPNs to work in their clinics, but not necessarily in the hospital. So that's kind of what I think. I don't know for sure. So in the military-based hospitals, yes, we actually have one here in Tennessee, or it's actually in Kentucky, called Blanchfield, that they actually hire LPNs too, but they actually hire them in their clinics. They won't put them in the hospital. They'll put them in their clinics. And to use them as techs is actually not really good, in my opinion. You have techs. We have techs, we have CNAs, we have those kind of people. So to use LPNs as techs is really minimizing or even discrediting our profession as a whole. LPNs are nurses, so therefore they should be functioning within their scope, but of course as a nurse. So that's kind of my opinion on that. I don't like when they get do that. Some advice for new CNAs. Like, tell me what your concern is, Miss Joyner. When you say advice in terms of what going to nursing school or how to deal with, tell me more. Like, are you speaking of um yeah, tell me what you're speaking of. That way I can answer your question the best. Thank you, Mr. Tighten Up, for sharing for me. Share, like, comment, invite. Tips for patient and nursing home. Okay, so when it comes to you and your job as a CNA, keep in mind, I want you to mentally think about the fact that for these patients, this is for, especially for nursing homes, this is they're considered to be residents. This is where they live. So this is because of where they live. They are treated differently in the nursing home than patients are treated in the acute care setting, the hospital setting. So just be mindful of those kinds of things as well. I would say make sure that you are taking care of your patients the best you can. And keep in mind there's reasons as to why that there's a high turnover in nursing homes for CNAs because of the fact that there's burnout. And there's burnout because you have 30, I don't know how many patients you may have, but you have a lot of patients, 25, depending on the facility, 25 to 30 patients a piece, or your side of the hall. You have two halls that you have to take care of patients on, and you're doing baths and things like that. I want you to remember why you chose to be a CNA. I want you to remember that these people, were once a lot of times vibrant and moving around just like you were. Make sure that you take good care of them, and make sure that you stand up for yourself when it comes to what you can and can't do. So what I mean by that is the DON or your LPNs, your nurses, they some of them don't care about you and what you do. You're just a CNA to them. Just like how we say we're just nurses, we're just whatever. You're just a CNA to them. So they might even care about what you do or not do. And so if you don't stand up and be your own advocate for yourself to say, okay, you know what? I need my lunch break. I need my 15-minute or have the breaks work. I need my breaks. I need I need everything that I'm supposed to have so I can take care of my patients better. Don't be in the habit of allowing them to dictate what you do and what you don't do. Don't be in the habit of allowing them to uh, not really allow you to do the things that you need to do to take care of your patients and yourself. If you need a break, make sure you get your break, because I guarantee you some of the other ones are going to be doing their break. And I watched this TikTok. His name is I forgot what his name is, but I'll put it in here somewhere. He makes skits on TikTok about CNAs, and one thing that his skits are very true, but he tries to make them funny, is that you'll have these CNAs who don't want to help, or they're older CNAs who don't want to help, or you have the nurses who don't want to help. Just stand up for yourself. Stand up for yourself, and simply say, you know what, I can't do, I won't do. And if they don't honor your breaks and don't honor your lunch periods and things like that, if you feel like your patient load is entirely too much at times, then what I really want you to do is be looking for another job. Simply just be looking for another job, because those kind of jobs are a dime a dozen. Just basically a dime a dozen. I told you the turnover rate is very high, so definitely do that. And just like I said, be a patient advocate and stand up for your patients and make sure that they're changed and clean and things like that. And try to always set up the next CNA, the next nurse, the next whoever for success. Just do that. Set them up for success, meaning that I don't care if you don't like the next CNA, the next nurse. It's not about you. It's about the patient, or it's not even about the next nurse. It's about the patient. So, and that's something I do even in my own practice. I could care less about the nurse per se, but I do care about the profession and care about my patients. So I'm going to make sure my patients are set up for success as well as my nurse. All right. So how legal is it if there is resident in long term? Okay, that's a good question. How I think that I think because LTCs are ran by the state, and hospitals are ran by JACO, that there is a different standard. Now, I'm not sure how they can get away with a CNA or even a nurse having 30 patients. I don't know how you honestly think that you can do adequate patient care like that. But what I will say is, because it is ran by the state, and just like I said before, just because of the fact that these are residents, these are not patients. Keep that in mind. LTC, long term care, nursing home, whatever, those are not patients. Those are residents. They live there. This is their house, their home. For many people who go to the nursing home, most of them, as you know, are not coming back out to go home unless their family members pull them out. I hate to say it like this, but a lot of them, they're going to the morgue after the nursing home. So keep in mind the standards are slightly different when, in my opinion, you've been written off from society. That's just kind of patient population it is. So they can get away with a whole lot more because, for one, you're not doing daily head to toe assessments on these patients. They get away with it because of the fact that you're just doing focused care, you're doing treatments, you're doing things like that, just to basically maintain them until whatever happens. If they are to be rehabbed because they had a stroke and then they go back home, that's something different. But I'm speaking more so of the ones who are going to live there. Now, when you talk about patient ratios on in the hospital setting, California is I think one of the only states that is unionized. That's the reason why they actually have strict rules in place regarding how many patients they can have. Now, I go work at a hospital. My job says my ratio is 1 to 6, but you better believe they will give me 7 or 8 patients if I don't speak up. So even in the hospital setting, people will push it as long as the nurse does not, um, as long as the nurse don't say anything. I've actually walked in one day and something said to me when I walked in, something says, go check the board, go check your board. So I go check the board. I didn't clock in yet. I went and checked the board and I went down the hallway and the other 2 nurses who were working with me, day shift was there. And I see them willing 2 patients change a shift down to our floor. That made us have 20 patients on the floor. Our ratio is 1 to 6, which means I have 6 patients. All of us have 6 patients. Once we have 18 or 19 patients, we need 4 nurses. And what ended up happening was we had 20 patients. And I told them I was not clocking in unless those other 2 nurses decided that they going to take 7 patients a piece and I take 6. I wasn't doing it because I stood my ground. I don't play that. And the only option was for them was to either let me have my 6 patients and they take the 7, or I go home. I hadn't taken a patient assignment at that point in time. I technically wasn't a no call, no show. So I was like, either I take the 6 and you all take the 7, or I'm going to the house. The backstory on this, and I think I did a video on this. If not, I'll be putting it out soon. Is that labor and delivery had brought those 2 patients over with nobody in the back. They had no patients back there. So they could have easily kept those 2 patients for us while we discharged at least 2 patients, and then we could have took them right on over. They had no patients. So there's really no excuse as to why they couldn't keep the patients, or one of those nurses could have came over and helped us by taking the 2 patients that we had, and then we would have had 4 nurses, and that would have been fine. But no, they didn't want to do that. So what they wanted to do was give us 20 patients with 3 nurses. I'm not that kind of nurse. So I simply said, either y'all take 7 or y'all can take 10. That's the only 2 choices y'all got. Otherwise, I'm going back to the house. Needless to say, they took 6. They took 7 and I took the 6. So, and then I took the first admit after that. I had no problem. After I discharged a patient or 2 of mine, I actually got rid of mine. I actually took, I think, the first admit after that, which was fine. So I think depends on where you are, Devin, that's how they do. They just do you like that. And I don't care unless you're in California, I guess, where it's unionized. And I'm in Tennessee, so I'm in South. And the South is even worse. They just do us like that. And they think it's okay. You said you have 50, yeah. And that's what I'm saying. You say you feel like your license is on the line? Yes. Because let me tell you, I have 4 children that I actually had. My 5th child is my license. So I don't know if you have any children, but that license is one of yours if you don't, or it's added on to the ones you already got. Your license is your everything, and nobody cares about your license more than you. And that's one thing I teach my nursing students when they are beginning to come out here, and everybody's telling them, do this, do this, do this, do this. And I'm kind of like, what about your nursing license? Because let me tell you something, nobody's going to back you more than you. No one likes you more than you. So they will tell you to do something. Your managers will tell you to do something that they wouldn't even do. That's what's sad about it. They wouldn't do it. And then if you ever had to go to court about it, they're not going to back you up. They're not going to sit there and say, oh, yeah, I told him or her to do X, Y, and Z. If they were a good manager, they would have told you no, not to do it. But that's not what they do. So, yeah, when your license is on the line, I don't play that. That's the reason why I said that one day that y'all take the 7, I take the 6, or I go home. Because at the end of the day, would you rather lose a job or lose your license? So think about that. Would you rather lose your job or would you rather lose your license? You lose a job any day, but you know how hard you worked for your license. You worked very hard for your nursing license. So why would you want to jeopardize that? So that's kind of what I believe in that. I don't play about my license. So, y'all can tell me there's the door and I will happily walk myself right on out that door because guess what? I still have my license. That's my livelihood. That's how I take care of myself and my kids. But once you lose your license, it is very hard to get it back. And or if you can't get it back, usually you can't. Also keep in mind if you only 20, 30, 40, 50 years old and you are a nurse and you decide, okay, I'm gonna go work at Walmart now, they're gonna be like, okay, wait, you was a nurse? So why who do you know gonna come from being a nurse to go work at Walmart? As an example, nothing wrong with working at Walmart, Dollar General. I'm not saying that. I'm just saying you had a lifestyle that you was making money as a nurse. No one who is not retirement age is going to say, okay, I'm gonna go ahead and put my nurse hat off and go work at Walmart for whatever reason. No, even the people at Walmart are gonna be suspicious of you, talking about like, okay, so why are you here? Why are you working at Walmart now when you could have stayed at working as a nurse? So don't let these people try to make you lose your job because if they do, then you're going to end up, like I said, when I say lose your job, lose your license. I could care less about the job. I could care less about the job. The license is what I'm concerned about. So yeah, protect that license at all costs. Protect that license like you protect your children. Protect that license like you protect anything else that's important to you. Because if you don't, like you protect your social security number, your bank accounts, your money. Protect that license just like that. That is something that no one cares about other than you. They will have you out here doing all kinds of stuff, and then you come to find out that you know that they wouldn't do it, but yet they're gonna have you do it. And then try to reprimand you when you get in trouble for it, for whatever you did. Well, like for instance, you say you have 50 patients sometimes. Okay, now what if someone falls, one of your 50 patients fall? And now you got to do I guess an incident report or whatever. That's what we do in the hospitals, an incident report. So you got to do some kind of report saying that they failed. You probably have to go do an assessment on them, probably have to notify some people. I don't know what all you have to do in a LTC. But okay, so why are you up here doing that with that one person? What's going on with your other 49 patients? Who watching over them? Nobody. The CNAs can't do it all. The other nurses, and they're gonna help you. Why? Because they taking care of their 50 patients. I don't know how y'all do it. I don't know how y'all do it. I know y'all love the people that y'all take care of, but I do not know how y'all do that. I just don't. All right, keep on questions. I love these questions. I love this. I'm actually enjoying this myself, so we definitely have to continue to do this. So, Mr. Wallace, or no, Devin. Devin is a unisex name. Are you? Well, whoever you are. What did you do about that situation? Like, what did you do about? Have you spoken up, or what have you done about that? Okay, Mr. Wallace. Okay, I just want to make sure I address you um, appropriately. So, what did you do about the situation? Did you talk to the DON? I'm really enjoying this. Y'all keep the questions coming. Anything y'all want to know, either about me, about nursing, about whatever, really. So let's talk about the usual response. What response do they usually give you? That this is a we got to work together, teamwork. What do they usually say? You know what? That the acuity thing, to a certain degree, is like that. But let me tell you something. Let me tell you something about the acuity thing. I don't know if you've worked at different facilities, but the ones that are private LTCs, the ones who look like mini mansions and they got private bathrooms and things like that, they working hard, but they're not working as hard as the ones who are on Medicaid and all that other stuff. the ones who you walk into those hospital or not hospitals, those LTCs, and you can smell urine at the door. Those kind right there, that they talk about a low acuity for who? Low acuity for who? Total patient care is not low acuity. Just because they live there, what they're doing is they're saying because they live there that they it is lower acuity because you're not trying to get them back to a certain baseline unless they are in rehab. If they're on the rehab side, that's different. We're trying to get them back to a baseline. But if they're not, if they're just living there, they're not trying to get them back to anything. They're just maintaining them until they unfortunately, transition. And I hate to talk about it like that, but that's just a reality. That's honestly when I realized that nursing was really about money first and healthcare is second or third. So 4th of July, to be honest with you, Ms. Joyner, I don't really, I don't know how to say this. I'm not really into that. I'm not really into that. My sister is cooking out tomorrow and we're gonna go to it, but I'm not really into the 4th of July. It's not really about us. I hate to say it like that, but it's 4th of July really about us anyway. So what we celebrating again? Another excuse for us to cook, for us to eat. As being black, we eat all the time anyway. We have no reason to we don't have to have a reason to celebrate to eat. We eat regardless. So it's not a thing for me. But I mean, I'm gonna go to the cookout and enjoy it just the same. So you see, you've done both working agency, the best decision ever. Yeah. So you know what? And you're exactly right. Working agency is good because the reason why I say that is because you get paid more money to put up with the BS. And that's kind of how I look at it. More money to put up with the BS is exactly how I think of agency. Or if I got to do this job, that's why travel would be great. If I could travel one day, that would be great. But right now I can't. Maybe in the next year or so, I can do a travel assignment next summer because I'm teaching full time now. Um, you tried to call the state. They do have hotline numbers, I think. Um, They do have a hotline number that you supposedly could call anonymously and report things. I don't know how accurate that is and have they traced it back to you or what would happen with that. We've had that at our hospital. We actually had to call. I didn't. A coworker of mine called about the unsafe practices, about the ratios at our hospital. And until they decide they're gonna come in and fix it, nobody's gonna advocate for me more than me. No one's gonna protect my license more than me. So I just am like, okay, you all do what you all want to do, and I'm tired of the nurses who sitting there crying and whining and carrying on, and as if you can't control your what happens with your license. Thank you, thank you, thank you, thank you. I'm really enjoying this live. Um, I think we'll definitely continue this weekly. Tell me, I know today is Yes, Saturday. Today is Saturday. What days of the week, and we'll get back to the questions in a minute, but what days of the week work best for you all? Once I start teaching in the fall, I teach during the day, obviously, and have clinical and things like that. So it would have to be in the afternoon, like 6-ish, which is Central Standard Time. I'm in Central Standard Time zone here. Um, 6-ish on the weekdays, but on the weekends will be good for you because I work some weekends and some weekends I don't. Okay, it's just becoming a joke. Yes, it is. I learned about I would want to say it was probably maybe 6 or 7 years ago that I finally learned that healthcare was, well, I wouldn't say 6 or 7 years ago. It was probably year 2 or 3 that I found out that year 2 or 3, I think that I found out that nursing was not about healthcare. When I came to be a nurse, I just loved what I thought. Doctors wore towards their patients, nurses wore towards their patients, and now I see that the whole thing was a facade, and it's it's not what I thought it was. And then once you see that play out, and you see how the have and have nots work, you can see how people who, when you don't speak the language, the native language, which is English, and well, English isn't the main language we have here in the States. Spanish is right behind it. But even for our people who don't speak English or don't speak well, think about the care that they get. So forget the fact that in a nursing home, like you were saying, Mr. Wallace. But what about the ones who don't even speak the language? They don't get good care either. At least not in the South, not where I work at. All the places I've been to, they're not getting good care. They get in the bare minimum because we can't communicate with them and we're not doing a good job about that. So that's kind of how I think of it. So okay, Saturday afternoon or Sunday. So I will. So I teach at 2 different schools. one I is my full-time job, one is my part-time job. So my part-time job, I work on the weekends. And I work. So, for instance, next weekend I'm supposed to be working. The next 3 weekends, I think I'm supposed to be working for my part time job. So those weekends or that I have to work during the weekend, I'll have to come on during the week, and then the ones that I don't, then I'll come on the weekend. And so we'll try to make it at least maybe 1 o'clock Central Standard Time or later, if that's what works for everybody on the weekend. So I try to, not do it too early in the morning so I can sleep in because it's the only time I get to sleep in typically. How do you say it? Is it Cachet? Is that how you say your name? Cachet? Thank you for coming though. It doesn't matter. I don't care. Just get here. I'm glad you're here. It says I'm late, but I was super hard to walk in. Yes, 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 yes. Welcome. So you do labor and delivery? You're an OB as well. It's so wonderful to see or to meet someone who is someone who else is an OB. Have you ever found though that when you do find someone who looks like you, y'all like long lost cousins? Your long lost cousins, and like you're so happy to meet them because of the fact that they look like you. You don't know nothing about them, but you feel like I don't know. I think that's by design, to be honest with you. I think it's by design that for whatever reason, we meet a quota. They put in one or two of us, and they're happy with that. I will say that I worked bedside until last August, and I would like to say that honestly, we have a unit of labor and delivery, postpartum, nursery, and NICU. So we have 4 different units on our whole floor that makes up OB. And out of 4 units, if I wanted to calculate total day shift and night shift, how many black nurses we had, day shift, night shift, all 4 units, I can count 4, including me. That is sad. We had probably about 100 nurses doing those whole four areas. So, um, so yeah, you're not gonna see many of us here. And that's the reason why when you do come, you have to come with your A game. You have to come knowing what you're talking about. Because if you don't know what you're talking about, what you're doing, they're gonna get you up out of there. They're gonna get you up out of there. They're gonna make you feel a certain kind of way, isolate you. But I think we have to have strong, thick skin, and we have to say, I belong where I want to be. I want to, I feel like just with anything else in nursing, in terms of being racist and how it can be, keep in mind this is a female dominated, a Caucasian female dominated profession, dominated profession. So you're gonna have people who don't want you. They don't mind if you were here, but they want you in med surge. Okay, they want you in med surge. Med surge, and if any of you all are med surge nurses, there's nothing wrong with being in med surge. What I'm trying to explain is that med surge to nursing is like McDonald's to the workforce. So let that see if that makes sense to you. Med surge to nursing is like McDonald's to the workforce. It's entry level. So we can be there. So no, may not be housekeeping. No, you may not be dietary, but you work med surge. Well, everybody work med surge. So when you come in and you go to a specialty like even ICU, ER, but especially OB, they're not really receptive of us being there. And many of them, Cachet is intimidated by us. And I can go to another whole story and dance about why they're intimidated, but they're intimidated by us. So you will not see them as often. No one looks like you, so you have to kind of accept that and keep it moving. Now, if you happen to live in like Detroit, Atlanta, I've said this in one of my videos, Chicago, Philly, New Orleans, places where there's a heavy population of us, then they don't they don't have the same issues we have. I live near Nashville, Tennessee. So Nashville, Tennessee, I'm in the South. And then, so you see black people all around, but if I want to go to a hospital and I see where the black people are, they in med surge. And I always made up my mind, I don't want to be a med surge nurse. Nothing against it, nothing against it. But if we're going to take care of patients, we need to take care of the patients we want to take care of. Because when these patients get on your last nerve, you want to be able to say, I still love my job. When they get on your nerve and you say, okay, I need to get up, I need to walk my patient. If I work med surge, but they say they don't want to walk, I'm like, okay, then fine. I'm going to document it and keep it moving. But because I love OB, I'm explaining to my patients why you got to get up and walk, why you got to move, why you got to move. We want you to be able to take care of your baby, yada yada yada. I love what I do, so therefore I put more effort into it, even if I'm having a bad day. So Kashay, just keep on pushing. If you love your job, um, just find a group of women, because it's mostly women, that you um can get along with. That's the biggest thing. Can you get along with them? And just keep, at the end of the day, just kind of remember that you're really not per se there to make friends. I'm sure you have your own friends. If you meet a friend along the way, great, but that is not really the focus of, you going to work every day. So just kind of keep it moving, and when you see one, just when you see somebody who look like you, welcome her. Please welcome her or him. Welcome them, because sometimes they want us, but they don't know how to accept us. And then, Cachet, we have to deal with all the microaggressions that we have to deal with. Like I asked you how to pronounce your name. They're gonna come up with a nickname for you. They're gonna come up with a nickname for you. And we don't like that. No, call us by our name. You can call all the Indians by their names when they have these long names. Call us by our name. So just be mindful of that. Um, Mr. Wallace. Yes, Mr. So you said while you were in LPN school, you brought up the fact that there was not one black person on staff. When you say on staff, do you mean at the school that you went to, or do you mean at the facility that you all? Where do you mean? Do you mean at the school that you went to? Ms. Cruz, I'm one of two black nurses in PACU. Yep, that's pretty typical. In PACU too. There's not many people in PACU. You're right. You said you're ICU and ER type of guy. Do you ever thought about travel? Yes, I have thought about being a travel nurse. I actually hold on just a minute. I actually wanted to do that. But my story for the travel nurse situation is just this. I had children very early, and I kept on having them. So I'm not gonna lie to you all. I have my girls. My girls are 23 and 20, and my boys are 12 and 9. And so if you watch any of my other videos, then you would know kind of what I got going on right now. So I have either had babies or I've been going to school. I have 4 degrees and I have 4 kids. So that's all I've been doing for the first half of my life, first half of my adult life, the 20, I'm 43. So I had her at 20, from 20 to 2012, which when I had my last one, it's just nothing but babies and not that whole time period, and then going to school. So I really want to do travel nursing, but I had to wait for my kids to get old enough. Well, now I've moved into academia full time. So I'm thinking about honestly taking an assignment, let's say during the summer, or maybe an assignment during the Christmas break where I can take my kids with me. And if I can do that and take my kids with me, they're not missing school and things like that. We could do a travel assignment, and that way allow me to continue working and getting those kind of skills that maybe I need to polish up on from moving away from bedside. So I still plan to do travel nursing. I just don't know when. I said I was going to do it this summer that we're in right now. Well, here we are. I'm about to start back working in a month, so that's not going to work. And I really enjoyed my summer off, so I may think about it next summer. But yes, I still want to do a travel nurse assignment. I still want to experience that. There's so many things in nursing that I still want to experience, but I think I just got burnt out of the politics of nursing in the hospital. I got burnt out that the people who are over me, now mind you, I have a doctoral degree. So people say, well, why do you have a doctoral degree and you still working bedside? Because I can. And I don't know how you think people can really teach students if they're not working it too. How do you think you can teach students if you're not working it to kind of know what the latest and greatest is? Right now, I'm not working it, but I do clinicals in which my clinical site allows me to take my students and do whatever I want to do with them. So that allows me to get the clinical side still in even today. But I do plan on doing that. Um, you say you're back in school now, pursuing your RN. I feel restricted with my LPN. Yes, I can understand that, but it's still one of the decisions you make. Yes. So you know what? So when it comes to your school, you said it was white female instructors, and I actually, thank you, Ms. Joyner. I actually went to a job, and it was an LPM. Matter of fact, it was an LPM program here in Tennessee. And what I did was, when I interviewed for the job, I went to their, the composites that they have on the wall, the composites that show all the students. So every year the students graduate, you have the hat on or whatever they have on, in those pictures that's on the wall. I went and looked at all those pictures. And what I did was I looked at the pictures and I looked at the population or the demographics of the students. And here in Tennessee, we have a large, or Middle Tennessee, we have a large like Kurdish, A lot of people from Africa, different areas of Africa, so Ghana, um, from Nigeria, from Egypt. We have students from all over. Just a whole sea of brown people. Let's put it that way. Indians, people from India. A whole sea of brown students, and of course African American, and of course Caucasian and Hispanic. So, but like you just said, the faculty was all Caucasian. And so when I went to my interview for that job, I got the job, by the way. But when I interviewed for the job, they were um they were basically like, well, what do you bring? Those standard questions that they ask you. What do you bring to the what do you bring here? What do we offer? What do you offer us? Is what she basically said. And I said, you know what? I offer you some diversity is what I'd offer you. I said, I looked at your board, your composites, and I said, I noticed that you have all these students who look nothing like you all. And I was direct with them. Now, mind you, I already have like 3, 4 jobs. So when I go to these jobs, I don't have to necessarily, um, I'm not telling you all to do this, but I know what I bring to the table. That question, what do you bring to the table? I know what I bring to the table. And at that point in time, I didn't have my doctorate. But I said, you know what? I said, you need to have faculty who looks like your students. You have all these brown students. I didn't go through all the, where they were from, but you have all these brown students according to your composite. But when I look at your faculty, it does not reflect your students, who does not reflect the population as a whole. So your students should always reflect your population that you have in wherever you're at. So we're in the United States, and because we're in the United States, we have a myriad of cultures. Of culture doesn't mean race, by the way, but we have cultures, we have different ethnicities, we have races. And how do you have a program in which you have not hired? I don't care if it's just a quota you need to meet. Y'all need to find y'all at least one black faculty member or one minority, and minority in nursing also means men. Men in nursing is minority as well. So you need to find you at least one. And for that particular role that I had, I actually got the job. So they liked that. They liked it, or whether they did or didn't, I got the job because they realized, yes, you have all these. Who's going to identify with somebody who looks like you? I mean, no, that didn't come out right. You would identify with someone who looks like you, and that's what doesn't make sense to me, because it's like, okay, how do you teach somebody? How do you teach somebody? Well, I guess you can, because we all don't come out of programs where we don't have no black instructors. I had one when I was in nursing school. I had one, and she retired the year that we graduated. She said, "I'm only here for y'all." And so, but I got the job, and I said, you all need to be mindful that we need to find people who we need to have people in faculty, which is something I'm still fighting for this day, and making sure that our attrition rates are improved. And attrition rates basically mean that how many students come into the program versus how many students graduate. Our minorities don't graduate at the same rate as our Caucasian students. When I say minority, I mean collectively. Our minority students do not graduate at the same rate as our Caucasian students. We have barriers. We have barriers that our Caucasian counterparts do not have. And that's just facts. Okay. That's facts. That's research based. Okay. So I'm speaking facts on that. And because of that, um, our students who look like me fail. And I say look like me as being brown skin. I don't care whether you Indian, I don't care if you from anywhere Africa, I don't care you from the Philippines, you Asian. They all have a harder time here in the States than our Caucasian counterparts. So I'm just one who always wants to push for us, which is why I got my doctorate, because we need to see that yes, we can do it, and somebody needs to look like us who can do it. How do you know you could never do it if you never saw nobody who looked like you, and you were never brought up? Because some of us not brought up the same way either. Some of us are brought up. I've never met a black nurse before. I never before I became a nurse. There's nobody in my family. I've never met a black nurse. When I went to the hospital, the only time I saw black people when I was little was the housekeeping and dietary. And I may have met a few LPNs along the way, but not knocking LPNs, but they made it seem like that's as far as you could go. They made it seem like being an LPN was like that's doing something, and it is doing something. But the thing is, we have no ceiling for us, and they want us to have a ceiling. There's a floor, there's a minimum, but there's no ceiling for us. We go as high as we want to go, and that's what they're trying to limit us on. And so therefore, when we have these institutions that have all Caucasian um, faculty, you have to keep in mind in order to be faculty somewhere, you have to have a certain level of education. A lot of us don't have that level of education. And then because of that, because we fail out of programs, then the ones of us who do make it, We don't have the level of education that's needed. And then keep in mind, academia does not pay the same way as clinical side pays. So therefore, some of us have to be willing to take a pay cut. For me, I didn't take a pay cut. I actually got more money doing academia than I do bedside. I'm making six figures now, where I wasn't making six figures doing bedside. So yeah, it depends on where you go. So don't let everybody make you fool you that academia don't pay. It don't pay in some places, but it pays me. That's why I'm here. That's why I don't have to work the entire summer. I can sit here at home and look cute. You don't have to do nothing the entire summer but work. I mean, but sit here and take care of my kids. So, I hope that some of you even come into academia at some point in your career, later in your career, come into academia and help the next person out. We have to reach back and pull back and help the people out behind us because sometimes people even don't even know where you can go. If you don't want to do academia, that's fine. Go get your doctorate and be a CRNA. Go do something else. Be a nurse practitioner. Go do something, but show the people that it can be done and we can do it. Thank you, Miss Joyner. I'm trying. You say I'm doing great. I'm trying. It's just that you know what, life is just as hard on me as it is on you all. And I will say, the higher that you go up, the harder and the most more lonely it is when you get up here. When you get up here, because you have more people who are trying to pull you back down and make you feel like, okay, did somebody just give you a degree? Nobody gave me anything. I worked very hard for that degree. I'm so proud, Miss Cruz. You say I'm proud of you for speaking about yes, I have no problem speaking about diversity. That's the reason why I get so much clap back is because of the fact that people say, even on my TikTok, if y'all don't know, follow me on TikTok. Um, I speak about diversity a whole lot. I got so much hate from people who were telling me that I was misrepresenting myself because I call myself doctor. Um, when I have the credentials, which is kind of sad. But yeah, diversity is a big thing for me because you can't have a whole world of people in the United States who look like everything, but you only have one race who is teaching them in this case. No, that's not because your patients don't look like that. So how are you going to have one race of people taking care of every single kind of patient there is, race of patient there is, but they don't understand that patient's culture, nor will they take the time to learn that patient's culture. See, I can't stand that. I'm like, okay, we need to have people who look like us, who understands us and knows how to take care of patients when we have these issues and wondering why Mr. Smith, an African American who is 85 years old, won't let you give him a shot because he may have been part of the Tuskegee experiment time period and he know about that. He don't trust y'all. Same reason why they having issues with these COVID vaccines. I won't get into all that today, but certain populations will not do that because of the history that we have. Sometimes it takes somebody who looks like us to get these patients to where they need to be. That's what improves patient outcomes by having diversity in nursing. Diversity in everything, but nursing is our topic here. Let's see. Mr. Wallace says, "Yep, you're right. My pleasure. I love doing this. Uh, can I please see one more? That they were a diverse group of white females. No, 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 no. See, that's what she don't understand. That's what in the South we say. In the South we say, "Bless your heart." So when we ever say, if you ever hear somebody in the South say, "Bless her heart" or "Bless his heart," that's not always a term of endearment. That's not a good thing. When we say "Bless your heart" or "Bless her heart," yeah, that's not a term of endearment. So that's what I would say to that. Bless their heart. You can't. What you mean? You have a diverse upbringing. I mean, and don't get me wrong. You can grow up around now. Have you ever met people who are Caucasian who grew up around Black people? They get it. You can tell by the culture that you can tell what they listen to. You can tell when people been brought up around Black people. So to a certain degree, yes. But does that mean you understand what microaggressions are? Does that mean you understand what we go through as minorities? Do you understand the fact that because I look the way I look, I automatically don't have the privileges that you have, even if you do something wrong? I don't have those same privileges just because of what I look like. Do you realize how we get automatically ousted just because of what we look like? They don't even want to hear us open our mouth to know whether we're educated or not. Do you know because I mean, I'm 43, but I look younger than when I am. So when I go to the hospital setting, I'm with my students. They're like, well, your instructor need to be here, da 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 da. And I'm standing right there amongst them. And they're like, and then they call me Dr. Pace Newburn. And they're like, oh, you a doctor? Okay, ignorance is bliss. I have my doctorate, but I'm not a medical doctor. I'm not a physician or anything like that. They're like, oh well, here we don't allow anybody to call anybody doctor unless they're a physician. I said, ma'am, Not today. Today we're making an exception to that because I've earned the title. And so, I have to fight that battle all the time. And that's what's so disheartening about about what I have to go through. So when I tell you we keep on going through it, no matter how high you get. So you said, can I please send you this email though? Yeah, please do. If you go to, well, I'll put it, hold on. Let me put it, my email. Put it in there. Make sure that's still right. So that is my email. I just put my email. So yes, send me whatever. I'd be interested to see that. And I'm glad you know what you said, it keeps you motivated. I'm glad because sometimes I tell people let people who are discouraging you keep you motivated to come back and show them. And then when you finish, you go back and send her via email that degree that you got, showing them what you did. Like I want to thank you for the encouragement and send. I mean, they don't know that's being petty and that's being passive aggressive. But here's my degree. Ms. Joyner says, "Oh, good, Ms. Joyner, you're gonna start your prereqs. Good, good, good. Definitely good because you need to definitely." We need you, and the fact that you are already a CNA and that you're understanding how healthcare works. Yes, I'm glad you're here. Yes, we do need more Black educators. That's again another reason why I'm here is because of the fact that I knew where my path was going to take me. I know that I love OB is my specialty. That's what I do. I take care of moms and babies and stuff like that. But education is where I have a passion for. I love education. And like you said, because when you see people who look like you, it just makes a world of difference. I just love it. I love it. Just call me Viv. Just call me Vivs. This is why I follow you on all platforms. No, I'm not. Yes, I'm not. I am not afraid to speak my mind at all. I will say whatever I need to say. And I try to be one thing about me though, I will say I try to be respectful about it. I try to be professional, remain professional about things at all times. Um, but I try to be professional, but the thing is, at the end of the day, I'm a person, I'm a human, and I try to keep my credentials in mind, like, okay, don't be acting a fool on these sites. But people will take you there. People will take you there. I'm not afraid to speak my truth. And I think that's the problem. I think a lot of us is too afraid to speak what our truth happens to be. And there's people who will come challenge you about your own experiences, trying to tell you that you didn't experience that. Like, was you there? No, this is what I've been through. So I don't try to make it about race in the terms of what it is, but it is what it is. It's about race. I got your email, Mr. Wallace. So yeah, I'm not afraid at all. Oh, and you from Memphis too? Okay. Memphians are very different. Anybody who've been around people from Memphis, Memphians are very different. I love Memphis. I go there probably 2 or 3 times a year. I'm right outside of Nashville, so I'm about 3 hours away from Memphis. Yes, you see that on TikTok. Yes, just call me Viv. They do. They push back. They be trying me. They be trying me, but like I'll come right back though, because I'm not afraid to. Um, I'm not afraid to at all. I think I pride myself on the fact that I don't have to curse anybody out. Now that's something I don't do. That's unprofessional. Now there's times where I've let some things slip, but I don't have to curse anybody out. But I'm gonna speak my mind. You're gonna know that I'm not here to play. I don't play that. I don't play that at all. But yeah, they give me some pushback on TikTok, especially. Welcome, Bree. Oh, single moms in school. Okay, so I have a video. You may have seen it already, but I do have a video on single moms in school. What I would say is, what I would say is, I first and foremost, I've been there. I have been a single mom. Have you seen that video, Bree? Have you seen the video? I saw it. Okay, all right. So that video was done when I first started my channel about right at 2 years ago, and what I said in that video still holds true today. But the biggest thing now that I'm an educator, now that I'm actually working as an educator and I see my students who are suffering, the biggest thing I do say is making sure that you have a support system. A support system. That is the biggest thing. Um, have a support system. That is something that, hmm, that's true with any student, whether you have somebody or not. Have a support system. Have somebody that you can talk to. Some of the things I talked about when I was in that video, in case the ones who have not seen it, if you're a single parent and find you a group of other students who happen to who either they single parents too, or they just don't mind hanging with you all and form a study group. And when it comes to studying, we would take our kids and rotate houses. So, like for instance, if it's 3 or 4 of us and we all had kids, what we would do is we would rotate houses and study. So maybe that way we didn't have to find a sitter. Everybody knew to bring when it was my turn, for example, everybody but knew to bring their kids to my house. I would have a little area set up for them to play, the kids to play. I had snacks, of course, for them to eat. I had actually made dinner for all of us to eat. And back then we all poor, so macaroni and cheese and a meat, some kind of chicken or whatever, that was sufficient because we was all broken poor in nursing school at that point in time. And that's what we did. That's kind of what we did. And then it was somebody else's house the next time. That way nobody had to worry about trying to find babysitters when it came to studying. We did things like that. That was helpful for me. Having a good support system was helpful. Having a backup plan. So when, let's say, if your kids are in school and they close schools, they may not close clinical that day because your school may not do what the local schools do. Have a plan for inclement weather. Who gonna take care of your kids? Who gonna pick them up? Who can keep them when they sick? Because nursing school don't play. They don't care who's sick, who died. They don't care about none of that. You better show up to class. And then I will say this: if you ever find yourself, if you are failing a class, I had a conversation with a friend of mine about this. She does dental hygiene, though, different program, but the principles are the same. The student was having some issues, okay, and they end up failing the class because they never withdrew from the class. If you see you're having issues in the class and your GPA, your grades are going down, and you're having a bad semester, don't be afraid to drop the course. Save your GPA, drop the course if you can. Does it may mean you get delayed in terms of graduation, but at the end of the day, it doesn't matter about delayed versus denied. Okay, delayed, not denied. I don't care how long it takes you to get there, just get there. So save your GPA if you see that you're not doing well in a class. Go ahead and drop the class by the drop date so that you can not have your GPA uh, suffer from that, and then take the class when you can take the class again. So just definitely have a plan for yourself because that's the biggest thing is just having a plan. Hold on, these comments are going. Let me make sure I catch everybody. Okay, yeah. Um, that just have a plan, and then you're gonna have some bad days. You're gonna not feel well sometimes. Have a plan that comes to your kids in terms of, like, for me, even still, I'm single parent again because I'm getting divorced. So I'm single parent again. So I'm back to that same single parent mindset. But if you're off on the weekends, you got to study. Go ahead and do the laundry. Go ahead and get your kids' clothes ready for the week. Go ahead and iron those clothes up and have them ready for the week. Go ahead and have snacks and stuff ready for the week. Pre-plan everything. Every night before we, let's say there's school on Monday, if there were, actually my kids are in a summer learning program right now because of the whole COVID situation. So they're still in school or they went back to school the summertime. We have, but if they were in school, I have my backpacks and everything lined up by the door. I have my bag lined up by the door. So everything I need for tomorrow for work, I will have my bag lined up by the door, the kids' backpacks, shoes, everything lined up by the door, clothes ironed, laid out. Even go as far as putting your bowl, like if they're gonna have cereal in the morning for breakfast, put your bowls on the table, put the cereal, don't put the cereal in the bowl, but you have everything ready to go, spoons out, and all you got to do in the morning is pour the cereal, pour the milk. If they can do it for themselves, let them do it for themselves. Have everything put out the day before if you can. That will help ease your day-to-day stress of taking care of the children and studying. Have a conversation with the kids about depending on their age. Now, if they are school age kids, guess what? Study together. Study together, meaning that, okay, it's time for mama to study. Go ahead and get your homework out, especially if you can do it independently. And we all going to sit here and do our work together because that means it's going to be quiet in the house. When they ripping and running, carrying on, you can't concentrate. So let's do our work together. I did that with my doctoral program. We would sit there and read, they would read their stuff and I read my stuff or whatever we need to do. I would say we need to, it's study time. We have to study together. They seem to like that because of the fact that they are um, involved, and that you're allowing time for them. If they're babies, you may have to wait till they go to bed for you to study, but you have to allow some time for that. And then the last thing I want to say about being a single mom is allow them to allow yourself to have time for self-care. Self-care is very important. And what do I mean by self-care? I mean do something for yourself. Now, you may not be able to afford a nursing school to go out. Right now, I take myself on a weekly date. A weekly date. If you follow me on IG, you will see that on a weekly date. Today is dinner and a movie. I go by myself. I don't want no girlfriends, no nobody, just me. And I'm going to go see The Purge, something, something about the purge, and I'm gonna take myself to dinner at some point. And that helps in two different ways. It helps me with self care for one, and it helps me realize I don't need nobody to take me out. I can do it myself. So two different situations, but it helps with both of them. Do something for yourself. Light a candle if you like candles. Take you a bath. Do a mani pedi. Get your nails done. I get my nails done every single 2 weeks. Um, when I'm not in clinical, because we can't have nails in clinical, so I can't get them done once I start clinical back. But either way, find something for yourself because that's what you need to do. Take care of yourself. All right, let's see. Just call me. Viv says, I'm a baby nurse LPN. I'm going to finish my first gig. Wait, I'm going into my first gig, eyes wide open, my goal CRNA. Oh, yes, great. You're going to be a CRNA one day. That's wonderful. So you do know that to be a CRNA, you have to get your doctorate, right? So hopefully you know that already. You got to get your doctorate eventually. And so be prepared to do that. You got time. Get your doctorate and um, take care of people, put them to sleep and wake them back up. Make sure that they're taken care of. That I think I admire CRNA so much. They are just so smart to me. All nurses are smart, but it's something about being a CRNA, have the power, having the ability to put people to sleep and wake them back up and taking care of them like that. I think that's just so wonderful that you have to be so math and well, nursing is a math science kind of focus, but still you have to know what you're doing to take care of people to make sure that you have the right dose and how much you can give, make sure you don't overdose them. I love CRNAs. Um, okay, cool. Start away from the bottom. That's the beginning of conversation. Yep, you're right, Mr. Wallace. Let's see, what would you do differently in your career path as a single mom? So tell me again what you mean by that. What would I do differently in my career path as a single mom? Oh, that's now okay. So this is the thing. Nursing is not conducive to families at all. I don't care if you're married or not, or in a relationship or not. Nursing is not conducive to families, and I say that because of the fact that it's just not. Nursing, especially in a hospital setting. In a hospital setting, nursing is kind of like okay, the hospital's open 24/7, as you all know. Um, it's 24/7, as you know, 365. It don't close ever. So just go ahead and make sure that I don't know if I would work in the hospital as long as I did. But I still think that working in the hospital is a foundation for nursing. I tell everybody that I know that, to go into the hospital setting at least for 2 or 3 years and learn how the hospital is ran. And then if you want to branch out into a specialty of some other sort, or if you want to go into research or go do something else, then go do it at that point in time. But definitely, definitely, definitely go to the hospital and work. But you may have to figure out a way to do that. Um, I'm gonna do a video on what was the title? I'm gonna do it on. It was on hold on, I put it in my notes on my phone. Let me see what I said. Notes. It was going to be on would I still recommend this profession? I'm gonna do a video on that, so definitely stay tuned for that video. Would I still recommend this profession? So I have a story to tell on that one, but I will say that as a single mom, I don't know. I think honestly, when I chose nursing, I chose it because of the fact that I was a single mom. I chose nursing because of the fact that I was going to have a career in which I didn't have to worry about what the world was doing. I didn't have to worry about per se layoffs. I just knew that I'll always have the money to do what I needed to do to take care of my kids. I knew no matter where I moved to, that I would have the money to take care of my kids without being on government assistance. And I think that was my biggest goal. Not having to depend on the father if he didn't want to do what he was supposed to do, take care of the kids, not having to depend on government assistance. I don't really care for that. I'm not knocking it because I was on it, but I don't care for it in the sense of I want to be reliant upon it. So that for me, that's what I did. I do think it's a great profession, but you have to have a support system in nursing, especially as a single parent. If you don't have a support system, if you have somebody who can pick up your kids up for you, working on 12-hour shifts and your kids get sick, or working 12-hour shifts and there's no school, if you have a support system, then this is still a great career choice, I think. All right. Yes, yes, yes. I'm actually going to do, on Bree on the narcissist videos. Oh my gosh, like the things I went through with that situation still going through the situation. I did find, I did yesterday finally found me, my insurance covers counseling. So I actually, they are working, the insurance company is working to find me a counselor in my area. If you all have not seen my, this is totally different about this, but if you want to know what's going on in my other life, go watch the series on my narcissistic marriage, my road to recovery, and it talks about basically what I've been going through and the stories behind that. There's about 30 something videos on that in terms of, what we go through when we're dealing with a narcissist. But yeah, and I'm going through that divorce process too, so I'm having to go through and figure this whole thing out. um Mr. Wallace, I agree. You should always have at least one day per week that you decompress. Usually that day I don't mind sleeping in. I sleep, I do whatever I need to do. Mental burnout. Yes. Yes, I have. At the hospital, and I would say you probably feel burnt out already, because if you done told me that you already, um, if you told me that you already done had 50 patients, and I'm sure that's not the only time that you've had that, or if you've had that many at any given point in time, then you're going to feel burnt out. Usually, nurses nowadays are feeling burnt out year one, year one. So I will say definitely, 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 have your and do a mental health day. Mental health don't mean we always depressed and carrying on. Sometimes mental health, we do things to save our mental health, so we're not depressed and carrying on. So maybe you are going for a walk. I actually work out. I work out 3 to 4 days a week at the moment. So because I work out 3 to 4 days a week, that actually helps me in terms of my mental health as well. um and going out and doing things help too. So I would definitely say, uh mental burnout, yes. The hospital was one of the places where I'm like, you know what? I'm at a point now where I don't even care. I don't want to say I don't care what happened to the patients. That's not the part. I don't care. When I would make sure that I would try to remain professional, I would notice I start getting short with people. I start noticing that, I would start calling in more. I'm not a one to call in to work. I will go to work. I hate it. I will complain the entire time, but once I get there, I'm usually fine. But I started calling in to work because I was mentally done. And sometimes it may mean you need a position change. You may need to go to a new position, maybe a new shift, maybe a new hospital, a new setting. It's okay to do any of those things that you need to do to take care of yourself mentally. Feel free to do that, and don't. And that's another thing. Learn to say no without giving an explanation. That's something I'm working on right now. When they ask you at these jobs, "Hey, can you work, an extra shift?" Oh, I know you could probably use the Christmas money or the vacation money or whatever. I'm good, thank you. No, no, thank you. I'm not interested in it. And leave it at that. We have a tendency as people to say no because it's not their business. Because why? No is a complete statement, period. So just simply say no. Thank you though for offering it and move it on. That's kind of how they do it. So be able to say no. That's what I'm working on myself right now. Learning to say no without explanation. I'm always good at saying no, but not without explanation. I always have issues with that. Learning to say no without explanation. Let's see. Bree says, I'm a CNA dedicated to become a nurse. I would love. Yes, good. So you are here for the right reasons, and that's the important thing. I always talk about, why are you becoming a nurse? Why are you wanting to become a nurse? Are you here for the right reasons? Because if it's because of money, that's the wrong reason to come. It's great money that you can make, but the thing is, I refuse to be a slave to make anybody's dollar. I refuse to be a slave to make anybody's dollar. That's the reason why I had to get out of bedside, because yeah, you can make good money, but at what's the cost? The cost is mental and physical. Your body will be broke down. You don't get any lunches. You got to go to the restroom and you can't go when you need to go. They're giving you more patients than you can handle. And if you can't handle, they want to talk about acuity. Acuity is a big deal. So, acuity is where, the degree of which the patient has to be cared for. And keep in mind, the first 24 hours of any fresh patient is the higher acuity. If you have a patient, I don't care if they can walk, talk, and whatever, that first 24 hours of when they're in that hospital, the acuity is higher because you are dealing with a new onset of whatever brought them there. So if you have 6 and 7 patients like that, you have to think for 6 or 7 people plus yourself. If I do this in this situation, if I do that in that situation, it's not like the textbooks. It's not like the textbooks at all. So yeah, definitely, it's mental burnout can be pretty serious. Therapy is such a life changer. I wish we would start normalizing. Yes. Oh my gosh. You know what? You just said a mouthful right there. I wish we would normalize it too in the Black community. I don't know why mental health is so taboo. I do not know why it's so taboo, and I that is something that I have learned to 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 deal with in terms of the mental health aspects. I always talk about going shopping in my retail therapy. Well, retail therapy is great, but it doesn't fix the problem. So we need to go ahead and really normalize mental health, because I remember telling some people in my family that I'm going to start counseling, and they're like, "Well, why?" Because you got rid of the problem. I did get rid of the problem, but the problem is the scars that was left behind after I got rid of it. That's the issue. That's what I got to work on. That's what I have to work on. We have to normalize doing those in our community, in terms of just simply saying, it is okay to get, I don't know why it's taboo. I think it's taboo because we associate mental health with needing a check. If you know what I mean? When we say people, oh, they got their check, you must be getting a check every month. Well, I'm not getting a check, but the thing is, I still need to recover from the situation that I got going on from this failed marriage. And the thing with that is, if you don't recover from that, then when you do find somebody new, whether it be a relationship or whether it be how you interact with other people, you will bleed on to them the issues that you had that you never resolved. And you're wondering why we all hurt people. Hurt people hurt people. We are hurting each other because we have not resolved issues from our childhood, if that is your situation, from relationships, if that's your situation, or whatever it happens to be. Even in the work environment, if you have if you have a boss who is controlling and micromanages and things like that, if he or she micromanages, I've met so many people who do that. They are micromanaging because they have lack of control in their personal life. So they try to make sure they can control you because they have been controlled in their personal life, whether it be a spouse or somebody has did something to them, and they don't know, and then they treat everybody else bad. And then when you treat people bad, what do we naturally do? Not on purpose per se. It's a trickle down effect. You want your patient to be taken care of in a hospital setting? Take care of your nurses, or not just nurses. Take care of your staff. You want your patients to be treated well. You want them patient satisfaction scores to be good. Take care of your staff. Your staff will take care of your patients if they're taken care of. If you are saying, okay, mental health, we want to make sure your mental health is okay. We don't want to bully you in the hospital setting. We don't want to do those types of things. So those are kind of things that I've been working on personally. I'm in terms of if I need to get help, which I've been saying for past year, I'm gonna get some help, and finally decided to bite that bullet and call the insurance company and say, okay, I need to go ahead and start this counseling and stuff like that. So they are actually looking for me to get a therapist as we speak. So I should hear back from them probably after the holiday, and get my session started. So I'm excited about that because um, we have to heal from within. We don't want to hurt other people on purpose, and that's what I don't want to do, is hurt other people, and don't want to hurt my kids. So in order not to do that, I have to heal myself or get healed. Good, Mr. Wallace, that you've learned that yourself, that you have to say no and leave it at that. I'm working on it. And a lot of us need to work on it. A lot of us need to learn how to say that, because if we don't, then we end up in a situation where um I don't know, where we end up continuing to hurt people. All right, this has been wonderful. This has been wonderful. So if you're not following me on TikTok, let me put that on here, because like who said it earlier that they be coming for me? Just call me Viv. Yeah, she said they be coming for me. They do. They come from me no matter what platform it is. I'm gonna put that on here if you're not following me on TikTok. Um, sure. So follow me on TikTok if you haven't already. I basically just do I'm not on there dancing and carrying on. Nothing wrong with all that. Nothing wrong with that at all. But I use it as a platform to kind of supplement this one right here. So if you want to follow me on TikTok, follow me on TikTok. Um and IG. Let me find I have IG. Hold on, let me put that in here too. And a lot of times, people want to know, what do nurse educators do when they're not working? That's what the IG is for, basically. Do that plus encourage people to go to school. Um, score. Yeah. So IG, that's all my things that I do. So anyway, any other questions you have? If not, then we are going to kind of end this for today. If you don't have any more questions, and I will be working on a schedule to come do this, like I said, every single week. So be on the lookout on the community tab on YouTube, and I will say, which day of the week it is for that particular week. It will be in the afternoons. It will be on the afternoons once I start class, once I start teaching. I start teaching Well, I report back to work August 6th. So we have about a month that we can play with, but outside of that, it'll be in the afternoons or weekends for sure. I am working the next, I want to say 3, 4 weekends, but uh, I'll have it. I'll have it on there so you'll know. Yesterday was a spare of the moment thing where I just popped it up. So you know what? I actually want to finally go live. Finally, now that I know how YouTube works and what I needed to do to get it fixed. So I really thank you for doing this. For you all for coming and chatting with me today. And if you have topics that you want to talk about, because I want to kind of leave this open to what you all want to talk about. I may have topics in mind, but I don't mind if we go off topic. So I really didn't want to come with a topic, just Q&A, just talking about whether it be the ones who want to talk about the narcissist type stuff, what I went through with that, the narcissism and that stuff, or whether it be um, nursing related, whether it be my personal life. I consider myself to be an open book. I have nothing to hide. I've made mistakes, and honestly, I wouldn't be here if I hadn't made mistakes. You can't have success without failures. There's no such thing. So, in order to be where I am, I have to have failures in life, and I've had plenty of them to get to where I am. So, I'm open book. So, I'm happy to talk about the single parenting, the bad judgment in terms of the men that I've been involved with, or the husband that I had, legally still have. Um, just things get us into these situations that we don't really think clearly about. And I don't want anybody to go through what I've been through. Uh, if you can be warned about it. I'm that kind of like I'm not old enough to per se be everybody's mom, but at the same time, I'm old enough with enough experience to know like don't do this. And if this does happen to you, do this instead. So hopefully you've enjoyed this the same way I have. And be looking out. I won't put a video out today. I'll put another video out on next week sometimes. I'm trying to do about 2 to 3 a week, but I think I'm going to do live more. I'm excited about this. I love it. So if you happen to love this the way I have been loving it today, definitely thumbs this video up. Share, even though I want to go off live, share the video. Share the video so people can see that we're actually doing live now, like I promised over almost a year ago. Once I get to 2,000 subscribers, and we are here now, and I'm here. So anything y'all want to talk about, just let me know. And I hope you all have a great day today, a great weekend, a great holiday weekend if you celebrate it. I do not celebrate uh, this upcoming holiday. It doesn't mean anything to me besides a cookout. Like I said, we can cook out any weekend. Uh, so I hope you all have a great holiday weekend and stay tuned for more content. Follow me on those other platforms if you so choose. Just so you know, the IG page is primarily just the background of me, the backside of me, the things that I do. Of course, I love to shop and be dressed up and go out and do things, but it is a page basically for if you want to know more about me personally, as well as a page for if you wanted to know about if you want to know about nursing and things like that and things that I've accomplished over the past few years. And then of course TikTok is an extension of this. And a lot of the videos, contents that I get actually come from TikTok here lately. People ask very good questions and I give that 60-second version of whatever it happens to be. So that's what I do on TikTok for the most part. I mean, I may do a few little trends or whatever, but for the most part, I'm not into that. All right. Well, thank you all so much for watching today. And I wish you all the best. And stay tuned for the next live. I'll be back. I don't know when, but I will be back within the next week or so. Maybe earlier in the week. Maybe a Monday or Tuesday night, like six-ish Central Standard Time. So if you are East Coast, it'd be 7 p.m. for you. I'll try not to hold you that late. But I'm trying to capture people who are working, people who are in classes, and they're trying to, get out of class or they're whatever they have going on. So I'm just trying to capture people at different times. And so whatever y'all want to do, just let me know. But until the next time, I will see you all later. You all take care. Bye.